My name is Robyn Tabibi. I'm a family doctor at Roselawn Clinic, and I've been with Health East for 3 years, and this is actually my first job as a physician out of residency. A lot of people out of my program had come to Health East and really had excellent experiences here. And when I was applying, they really had a streamlined process for hiring. I really enjoyed the clinic here where I applied, and they were serving a patient population that I felt was very deserving of care and yet is highly underserved. And I thought that the work that they were doing here was really excellent and very necessary, and it was exactly what I was looking for. The OB care that we do here is one of the most rewarding and one of the most challenging parts of the practice that we do. We're very lucky in that we have a pretty robust OB practice, and we call and share our hospital rounding with a few of the other clinics, and it's an honor. It's an honor to be able to help people through that process of pregnancy and then to see their children afterwards. It's one of the reasons I became a family doc. The Roselawn Clinic is a little bit different from some of the other clinics in the Health East system in that it serves primarily a refugee population, and a lot of refugees from Southeast Asia, some of whom just walked off of a flight a week ago, and this is the first entrance or the first contact that they'll have with the healthcare system here. And we also see a lot of Spanish-speaking patients, a lot of Hmong patients, as well as a lot of patients who have been at this clinic longer than any of the physicians have. So it's a very nice blend of interesting medicine and interesting patient populations, as well as a lot of underserved populations. I have never in my life drawn out a colonoscopy preparation for an illiterate patient until I came here, so it makes you be creative in how you practice and also go back to very basic things, very basic education on how to take your medicines, how to access health care, as well as seeing diseases and healthcare problems that you probably would never otherwise see in your practice. So we get to see a lot of tropical diseases here and a lot of conditions that I have only otherwise read about in textbooks, so it's quite fun. The newer people who are here have really been drawn to this clinic because of the population that it serves and the work that it does with new immigrants and with refugee medicine. And it really creates a culture of service and a culture of dedication to this very challenging and unique patient population. And it makes for very interesting and exciting people to work with. I think increasingly so, our leadership is listening to what it is that we have to say as family docs and helping us to maintain a practice that we feel best helps our patient population as well as helps us as physicians to do the work that we started out wanting to do as medical students, as residents. And I think that that's very valuable to know that you have a voice in the organization that you work in.